Onc Live Insights is a video editorial program produced by Onc Live.
Nausea and vomiting are still major fears for a number of patients as they're about to receive chemotherapy. This is despite us being much better at treating this particular problem at medications which actually can cost hundreds of dollars for each course of antiemetic therapy that you give. Telling patients that there are different chemotherapy drugs that cause different amounts of nausea and vomiting, some less so and some more so, can be helpful for them. Telling them that we have much better treatments for preventing this problem can be helpful there. Letting them know if the first thing doesn't work, we can actually adjust it for different cycles. I think these days that people are not quite as afraid of nausea and vomiting as what was happening in the distant past. Part of this thing why they have this fear of nausea and vomiting is you see it on TV and it's just inbred into the chemotherapy process. When thinking about trying to control nausea and vomiting related to chemotherapy, the main thought is to try to prevent it as opposed to treating it after it happens. If it happens, then the person has more trouble with this anticipatory nausea and vomiting. So prevention as much as can be done. Although you don't want to spend tons and tons of money on people who hardly have any risk of getting nausea or vomiting, but putting those into perspective, prevention is the main thing that's considered.
So it's very important that when we start a chemotherapy regimen that we really lay the expectations out for patients. A lot of them will come in to the first cycle of chemotherapy relying on other family members' experiences or what they see on television, and they expect that nausea and vomiting is going to happen. We really need to let them know that our goal is complete prevention, and in fact that they should expect nausea and vomiting not to happen, and that if it does happen, they need to get a hold of one of their healthcare professionals, whether it's their oncologist or pharmacist or nurse, to let them know that they are experiencing CINV so that we can do something different with the next cycle of chemotherapy and prevent it from happening. When starting chemotherapy, it's very important that we talk about the importance of starting a good antiemetic regimen prior to the administration of that chemotherapy. It's important that we look at a lot of factors, not only just the chemotherapy that's administered, knowing that various regimens and various agents have a higher and or lower risk of CINV. We also look at patient factors, things such as prior history of CINV with other cycles that have been given. Look at things like motion sickness or history of pregnancy, emesis with pregnancy, and also their alcohol intake on a routine basis. And it's very important that we talk about adherence to the regimen that we set forth, that if they don't take their antiemetic in the appropriate time, their risk of CINV greatly increases. We tell patients also to look at their diet, make sure they're not eating things like hot and spicy foods during their chemotherapy regimen. We also use some non-medication tactics such as visualization. Acupuncture has been used in the past. And it's very important that also patients tell us that if they do experience CINV, that they do tell us that just because we didn't prevent it, there are things we can do to treat it.